Can I put it myself now? Let's see. Will you do it for me, Adam, or can I do it myself?
Yeah, I'll do it. I'll do it.
You will return. Okay. So thank you very much for inviting me to present the Calcifade study, which is a study on the effects of etidronate on calcifications in the brain of patients with Fahr's disease or syndrome. Next slide, please. Can I have the first? Yes, thank you. Let me first introduce myself a little bit more. I work at the University Medical Center Utrecht, which is a large academic hospital. And I don't know if you know Utrecht. It's a beautiful city located in the center of the Netherlands. And already since 2018, we opened our specialized Fahr outpatient clinic. And currently around 80 patients are diagnosed, treated and follow up at our clinic long-term for several years already. So we're really happy with that. Can I have the next slide, please? At our Fahr clinic, I work closely together with a multidisciplinary team. I can do it alone, of course, and we have professionals from different areas of expertise, including geriatric medicine, neurology, radiology, psychology, nursing, physiotherapy, rehabilitation therapy, and internal medicine, and also genetics, of course. And so you can imagine that there are a lot of people working together on working for patients with this disease. And nowadays we receive patients from all over the country and even beyond, such as from Belgium and Germany. So it's expanding quite quickly. Next, please. Apart from our clinical care, my team also conducts a lot of scientific research to improve our knowledge on the origin, symptoms, and treatment of Fahr's disease. For example, we studied which symptoms patients present if they are diagnosed with Fahr's disease. And Amit already told a little bit about this. And also we investigated whether symptoms are more pronounced when there is a larger amount of calcification in the brain, because it's very important to know if the calcifications are related to symptoms, because if that's not the case, then any treatment to the calcifications won't bother us. Next. Can I have the next, Adam? Yes, great, thanks. We included 50 patients in our study, and the patients had an average age of 64 years, ranging from 18 to 88 years, so also very old people were included. And there was an equal number of men and women. At the first visit to our clinic, most patients were independent in activities of daily living, but of course the older people had some help from family or other people. And gene mutations were found in almost half of the patients, with mutations within SLC28-2 as the most common outcome. Next, please. 41 patients were considered symptomatic, and this was over 80%. So a lot of patients who come to our clinic are indeed symptomatic. And of these patients, the majority showed motor dysfunction or cognitive disorders. And Parkinsonism was present in 1/3 of the patients with movement disorders, and also an increased fall risk was seen in over half of the patients. So that's also an important problem if patients visit our clinic. Over 80% of the patients with cognitive disorders had a decline in global cognitive functioning, and 40% in attention and 20% in memory. So that's also quite frequently a problem in patients. And about 1/3 of the patients was diagnosed with mild cognitive impairment. So that's the picture that we see at our outpatient clinic. Next, please. Well, this is a rather complex slide for the audience, but it tells us that patients with a higher amount of calcification in the brain significantly more often have symptoms like slowness of movement, gait problems, an increased fall risk indeed, or cognitive problems like a decline in attention. And this is important because we need to know this if we want to do a study to reduce these symptoms. So it's good that we have evidence now that it's really related to calcifications. In another study, we also found that symptomatic patients have significantly larger amounts of calcification than patients without symptoms. And we measured this, and patients with symptoms had an average volume of calcification of 13.6 cubic centimeters, while this was much lower in patients without symptoms, namely 1.6 cubic centimeters. So that's the big difference between symptomatic and asymptomatic patients. Next, please. And currently, unfortunately, no treatment options exist which could halt or diminish calcification. However, several medicines have been investigated, as Amit already showed already, and these have promising results in slowing disease progression. But most studies were performed in specific other patient groups, like patients with chronic kidney disease. Still, the evidence also in this group, in these groups, are still insufficient or conflicting. And a novel approach in the field of calcification disorders is treatment with bisphosphonates. And bisphosphonates are medicines prescribed for patients with osteoporosis. Bisphosphonates are very similar to a natural occurring substance in our body that is called inorganic pyrophosphate. This PPI is a strong inhibitor of calcification in soft tissues in the body, like the blood vessels. And a particular interest is taken in etidronate due to its close chemical structure to PPI. And over the last few years, several studies have evaluated the effect of bisphosphonate therapy in genetic calcification disorders, such as PXE, which is another calcification disorder. For example, in a recent study performed in those PXE patients in our hospital, concluded that treatment with etidronate, which is a first-generation bisphosphonate, significantly halted calcification in the blood vessel of these patients. And currently, several studies are being undertaken to assess the effects of etidronate in patients with other diseases like ACDC and other calcification disease, and also in our hospital in patients with PFBC or Fahr patients. Next, please. Well, this brings us to the Calcifade study. The protocol of this study has been published in 2024 in the Orphanet Journal of Rare Diseases and can be found online if people want to read it. Next. The aim of our Calcifade study is to determine whether etidronate can halt a decline of cognitive functioning in patients with PFBC after 12 months of treatment. And the secondary aims of the study are to determine whether etidronate can halt decline in mobility, neuropsychiatric symptoms, dependence in activities of daily living, quality of life, and also, of course, of calcifications in the brain. And patients are treated during 4 cycles with 20 milligrams per kilogram etidronate in capsules during 2 weeks, followed by 10 weeks without intake of the drug. And that happens 4 times during 1 year. Next, please. Patients can be included in the study when they are 18 years or older and have a clinical diagnosis of Fahr disease or syndrome. And a clinical diagnosis means that the patients have symptoms consistent with Fahr disease or syndrome. So that's quite broad. And also that there are calcifications in the basal ganglia on both sides. Next. Patients cannot be included in the study for several reasons, so that's also important to realize. For example, when they have a severe kidney impairment, or when they are pregnant or have an active pregnancy wish, or if they use bisphosphonates during the last 5 years. So that's also important to know. Next. The study protocol is depicted in this slide, and a total of 98 patients will be included in the study, of whom 50 already are included in our hospital in the Netherlands. And side effects generally are mild and mostly concern nausea or other intestinal complaints. And up until now, very few patients had to terminate their participation due to more severe side effects, and mostly that is nausea. The study is expected to start in the UK coming spring, and it's already open for patients from Germany and Belgium. And subjects who are interested in participation will be invited for a screening appointment at visit 1. During the screening appointment, an informed consent will be signed, and furthermore, a CT scan will be made for determining calcium volume at baseline, and also blood sampling will be performed. Also, neuropsychiatric cognitive mobility assessments will be done, and several questionnaires will be taken. And if a subject then meets all inclusion criteria, and if exclusion criteria are not applicable, patients can be entered into the study. And then randomization will take place to determine whether patient will be assigned to receive either etidronate or placebo. Placebo is a fake drug. Then the first of the 4 2-week medication intervals will be initiated. At 6 months, laboratory measurements are repeated and a telephone consultation will take place. And then after 1 year, a completion visit is scheduled with repeatment of the blood sampling, physical examination, CT, and all the other assessments. Next, please. As you can see here, the time schedule of the Calcifade study spans several years. Our application for a grant from the Dutch Brain Foundation was submitted in 2021, and preparation of the study started in 2022. Then we had approval of the ethical committee in 2023, and thereafter the first patient was included in April 2023, and inclusion was expanded to German patients due to insufficient patients available in the Netherlands. Luckily, at this moment, we have 50 patients already included at our hospital, and we are waiting to receive approval from the British Ethical Committee to start with the study at UCL in London. And hopefully we can start there coming spring. And the last visit of the last patient will be expected then at the end of 2026, and the outcomes of the study are expected to become available in the second half of 2027. So we need a lot of patients before we can have the results. A lot of work to be done. Next, please. To conclude, patients with PFBC have a broad range of symptoms, but evidence-based treatment is currently not available. And etidronate promises to be an effective treatment, and participants for the Calcifade study are very urgently needed to actually prove that this is a good treatment. Last one, please. So thank you very much for your attention.